A very good morning, children. Hope you're all doing fine. So, I hope you understood the passage or the paragraph which we read yesterday, that is pathway of the air from the nostrils to the blood. So, we have seen the nostrils, nasal cavity, pharynx, larynx, trachea, bronchus, bronchioles, alveolus, and also the blood. How the oxygen transports from one part to the other part in the respiratory system. So how it reaches the blood and all, that's we have seen yesterday. So there are a few things which are to be noted. So especially when we are talking about the pharynx, we have a conversation about epiglottis, right? So today we are going to deal a topic which is called as epiglottis and passage of air. Epiglottis and passage of air. So now this is the one which we have discussed earlier. Like, when we were talking about the pharynx and all, we have come across a word called as pharynx, called as epiglottis. So we are going to discuss a bit in detail about the epiglottis. So now we have already seen that this is the nasal cavity, okay, and this is the oral cavity through which the food comes in. So now this region is the pharynx, okay, this is the pharynx. So now this pharynx becomes the common passage for the air to pass and also common passage for the food to pass. So now there are chances that the food which you eat may enter into the larynx. So basically the rule is that the food should not enter into the larynx, because the food, if it keeps on falling in the lungs, so that will lead to the death of the people. So that's why the food should not come into the lungs. So to prevent that, there is a valve-like structure which is present here in the pharynx region, which is called as the epiglottis. And what happens here is, whenever you swallow the food, it will not work when you normally breathe and normally talk with each other, talk with any other, so it will not work. But especially when you swallow the food, when you make your tongue to swallow or to push the food back, and then when you, okay, only at that time, what this does is, this epiglottis will cover this particular part, so that the food will not enter into the larynx, but it will be directed towards the esophagus, which is also called as the food pipe. So that is how the pathway of the food is prevented from entering into the lungs. So this is the part which is the epiglottis. Especially when we swallow the food, that particular food will not enter into the lungs or into the larynx, but that will be subjected towards the esophagus, which is also called as the food pipe. And that is the reason why you cannot breathe when you swallow the food. You also imagine that you're swallowing some food and at the same time try to breathe. So that is highly impossible. You cannot inhale and swallow at a time. Okay, so when you swallow, the complete passage of the larynx will be completely closed with the epiglottis, and it will not happen. So that is how epiglottis will prevent the food from entering into the lungs. Okay, and also there is a small problem here, that is, whenever you are eating, our elders and all know, like they say that we should not talk while you are eating the food. So while you are eating the food, when you keep on talking, and when you swallow the food you keep on talking, sometimes what happens is, this epiglottis will not be completely closed, okay, and because of that, some of the food particles may enter into the larynx. But even then, we have some opportunities of positive opportunity here, that you will get a sneeze through which the particles which are in the larynx will be directed towards the nose, and those particles will come through your nose, isn't it? They will go through the pathway of the nose, and they will come through the nose. So that is how your the epiglottis is actually preventing the entry of the food particles into the lungs or into the larynx. So, and then it will be, when the epiglottis is closed, it's a valve-like structure, and when it closes, the food will be directed towards the esophagus, and after that, from the esophagus, the food will reach the stomach. So this is how epiglottis works. It's a very, very important question. I want you to write it in your book without fail. Now we will go ahead with the mechanism of respiration in human beings. Mechanism of respiration in human beings. We all know that we inhale the air and we exhale the air. So nothing but breathing is a process of inhaling and exhaling. So if you inhale oxygen, what you exhale is the carbon dioxide. So inhale and exhale is together called as breathing. So these are the, now what are the organs which are involved are the lungs. So the lungs will take care of this kind of breathing and all. Okay. So now what we will do is we'll just keep your hand on the chest and you inhale. And you can see that the size of your chest is a bit increasing, and then you exhale the air outside. Again, it comes to its own position. So now this is the process which you have done it voluntarily now. So you have inhaled the air and then you have exhaled the air. So you basically respire 18 times per minute. But every time you are not doing that. See, the process of your respiration, process of inhalation and exhalation is completely involuntary. It is being taken by something else in your body. The action is being taken by something else in your body, and you are not taking it voluntarily, isn't it? So the walls of the chest and also a special part which is present under the lungs, which is called as the diaphragm, are actually helping in the respiration process. So the chest wall here is completely made up of ribs, muscles, and also the skin. So the ribs are attached to a particular point which is called as the spinal cord, or you can say it's a backbone, right? From the backbone, you can see the ribs coming out and making a cage-like structure in which the lungs and heart are protected. So this cavity is called as the thoracic cavity. If you feel that the rib cage is a room and this diaphragm which is under this one is like a floor. Okay, if you feel that if it is a room, okay, if the lungs, the ribs, okay, if this thoracic cage is like a room, then this diaphragm will be like a floor. So now what is the function of the diaphragm? So whenever the air has to come inside, that means the lungs has to expand. So now here the diaphragm which is there, okay, which is here, will be in a dome-like shape, and what it happens is it will contract. So that the size of the chest cavity will increase. So when the chest cavity increases, the pressure in the lungs will decrease and the atmospheric pressure will increase. So within no time, the atmospheric pressure will rush into your nose and then it comes directly into the lungs, and that is how the inhalation occurs. This is also called as inspiration. It's also called as the inspiration, right? And after that, what happens is this diaphragm will come back to its normal position. It comes back to normal position by pushing the lungs upwards. So what happens is then the pressure in the lungs will be very high than that of the atmospheric pressure. So the air which is in the lungs will rush out through the nostrils. So that is how expiration occurs. Expiration is nothing but the exhalation. So exhalation and inhalation depends upon the activity of the diaphragm. So you can see this diaphragm which is really helping us in lot many ways, isn't it? So without diaphragm you cannot respire. So this diaphragm is helping you when it flattens, the chest cavity will be increased so that the air will rush into your lungs, and when it comes back to its normal position, then it will push the lungs upward so that the pressure will be created here. It will be higher than that of the outward pressure by the atmospheric pressure. So the air which is in the lungs will rush out through your nostrils. This process is called as the exhalation. So the inspiration and exhalation is happening because of the diaphragm and as well as the rib cage. Okay, so this is the most important topic which may come in the examinations also. Okay, let's discuss few points about the lungs also. So you can see the lungs here, these lungs, okay, you can see two lungs here, right lung and left lung, and these two lungs are covered by a double membrane, right? That means there are two membranes which are covering this, lungs. Okay, so these two membranes are called as the pleura. The double membranous structure which is covering the lungs is called as the pleura, and also there is fluid present in between the two membranes. Okay, this fluid will protect the lungs from the external shocks. So pleura is a double membranous structure, which this question comes in the one word answers, that is MCQs and all. So this pleura is a double membranous structure which is present around the lungs. Okay, now coming to the lungs, they are spongy in nature. They are elastic in nature because they have to expand. If they don't expand, the air will not rush inside. So if the air has to rush inside, they should expand, and they should be spongy and elastic in nature. And if you compare the two lungs and all, the left lung is smaller than that of the right lung. What is the reason behind that? Why the left lung is smaller than the right lung? Because left lung will give a little bit of space for the heart. That is the reason why left lung is a bit smaller than that of the right lung. So the lung capacity is around 5,800 ml. The capacity of the lungs is around 5,800 ml. So this is a little bit of information about the lungs. Okay, now we will see how gaseous exchange will occur in the alveoli to the blood capillaries. That means whatever the gases which are present in the alveolus, how they enter into the blood cells. That is what we have discussed yesterday, but we will try to discuss that in a detail now. Okay, now you can see that this is the bronchiole. Okay, this part is the bronchiole, and this one is the alveolus, right? And this one is the blood capillary which are attached to the alveolus, right? So we have already seen that alveolus will have blood capillary network around itself. Okay, so now why this network is present at the alveolus? Because they have to bring the carbon dioxide and they have to take the oxygen away. So now coming to this situation here, now when you take the air inside, okay, what is coming inside is the oxygen. So how does it come inside? How does it come inside? And we are saying that there is an exit of carbon dioxide, and how does it exit outside? So that is what we are going to study now. Now these blood vessels will bring the lot of carbon dioxide from the cells. That means these blood cells, okay, or this the capillary network will bring large amount of carbon dioxide from the all cells and tissues of the body. That means this alveolus will contain very good amount of carbon dioxide. That is, high concentration will be of carbon dioxide. So carbon dioxide will be in high concentration, isn't it? And when you respire, the air will have oxygen and carbon dioxide and also nitrogen. So oxygen is 21% here, carbon dioxide is 0.03%, and nitrogen is 78%. So when these gases come inside, the alveolus, which concentration is high here? Carbon dioxide concentration is high. Okay, and here in the atmospheric air, there is no proper concentration of carbon dioxide because it's very, very less when you compare to the concentration of carbon dioxide in the alveoli, right? Alveolus. So what happens is this carbon dioxide will move from the alveolus to the outside, and then that is how the carbon dioxide will be eliminated outside. It will be exhaled outside, and then when you see here, the oxygen which is in the alveolus will be low because some of the oxygen will be already used up. So the oxygen levels will be low here. So now here, whereas here in the oxygen which has come to the air, it has some 21% of oxygen. But whereas here, it is a bit less amount of oxygen. So what happens again? So the oxygen molecules will move from this higher concentration into the lower concentration. That means again this alveolus will be filled with the oxygen. So whatever the carbon dioxide is here, it will be exhaled outside, and from the air it will take the oxygen. Okay, and that oxygen will enter into the blood vessels again, and these blood vessels will take them to the different cells and tissues and all. Again the same process will occur. So when it goes inside, when the oxygen goes inside, again the same process will happen here, because oxygen deficiency will be there, because the blood cells will take the oxygen to each and every cell of the body. That means the blood cells will have very less amount of oxygen. That means concentration of the oxygen is low in the blood vessels, but whereas in the alveolus now it is high, because already oxygen has come inside. So again the same process will happen here, higher concentration to the lower concentration, and again this particular blood will go to each and every cell of the body and then collect the carbon dioxide and comes back to the lungs. So that is how this process will make sure that there is a gaseous exchange in the alveolus and also in the blood capillary network. So as a result of the gaseous exchange here, the composition of the inhaled air and the exhaled air, definitely there will be a difference. So the inhaled air which has come inside will contain 21% of oxygen, and carbon dioxide percent will be 0.03, and nitrogen will be of 78. Do you think it will be the same when it is exhaled outside? No, it will be 16% of oxygen which will be exhaled, and then it will be 4.4% of carbon dioxide which will be exhaled. Before that it was only 0.03% when it is inhaled, but when it exhaled it becomes it becomes more than 4.4%. And nitrogen, if you check it out, it will be same, that is it's 78 and 78, because our body will not use the nitrogen for any cause. So the nitrogen will remain the same, but there will be differences between the oxygen and the carbon dioxide. So by this we come to the end of this topic today, and tomorrow we'll see the transportation of the gases and also cellular respiration, which are very important for your examination point of view. Until then, see you all, take care, have a great day.